to Ask the Patient Advocate podcast, where we will discuss all things related to navigating your health. I am Dr. Elena Borrelli, and I'm so excited to talk about such an important topic of private patient advocacy. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together. Welcome back to a new episode of Ask the Patient Advocate podcast. Today we are diving into a fascinating and often misunderstood topic, disorders of gut-brain interaction, also known as DGBIs. Our guest today is Christina Unger, a nurse practitioner, yoga teacher, and medical technologist with a specialty in microbiology. Christina brings a unique and deeply holistic approach to healing the gut, and she's here to share how mind-body practices like yoga and gut-directed hypnotherapy are transforming care for patients struggling with various conditions such as IBS, functional dyspepsia, and more. So welcome, Christina. How are you doing today?
I'm doing great. Just came back from the beach, actually. So thanks
Oh,
for having
wonderful.
me.
That sounds lovely.
Yeah, it was.
Where at?
Stone Harbor, New Jersey. I live in Virginia, but I grew up in
Nice.
New Jersey, so I like to go to the beach there and ride the waves.
Oh, that's wonderful. That's wonderful. Well, this topic is so interesting to me because I know I have so many patients and so many clients that struggle with different disorders like IBS and gut issues, and it's like an ongoing struggle to manage it, and a lot of times they're not really familiar with this whole gut brain interaction, and a lot of it is still like not well understood and things like that. So I think this is a great episode to talk a little bit more about that and get your knowledge on it and share that information.
Yes, I agree. And there was a study a few years ago that was multinational and showed that 40% of the world's population has at least one DGBI.
Oh,
So,
wow.
yeah.
That's amazing. So can you help our listeners understand what exactly disorders of gut-brain interaction, or DGBI, actually is?
Sure. So, anyone who's had butterflies in their stomach before a test, or even me before this podcast, has experienced that gut brain connection, right?
Sure. I get it
And
before a test. I remember in school, anytime before an
exactly.
exam.
Yeah, when I used to have algebra in 8th grade, every day I never understood, why do I get a stomach ache? So, yes. So anybody who's experienced that has experienced this communication with the gut and brain. And the communication between the gut and brain is actually bidirectional. The gut talks to the brain and the brain talks to the gut. And you might say, well, how does that happen? It happens through multiple mechanisms.
Oh, yes.
Your body creates chemical messengers known as neurotransmitters, and we all know about serotonin because we hear about it all the time. But a lot of people don't realize that
Yeah.
over 90% of serotonin is manufactured in the gut. And the microbiome is so important for that. And that kind of makes sense, right? Because a lot of times when we're depressed, we don't feel good in our gut. And when our gut's upset, we don't feel good in our brain. And that's because the two talk to each other. But they also talk to each other through hormones. Like, who of us hasn't had noticed that during their period, they notice a change in their bowel functioning or the way they feel, right?
Yeah.
Yeah. And their immune system, and your gut actually has its own nervous system called the enteric nervous system, and it's also known as the second brain, and that brain talks to the brain in your head. But disorders of gut brain connection, a lot of reason that people are confused by that is that it used to be called functional disorders, and that really wasn't a very good name because people were like, what is a functional disorder? But basically it meant that when you went to the doctor, maybe they did a bunch of lab tests, maybe you even had a colonoscopy or an endoscopy and imaging, but nothing showed up. And so it used to be that patients would go to their doctor, have all these tests, and then their doctor would say, well, I don't know what's wrong with you. But that thinking has really changed because now we're starting to understand the connection between gut and brain, and people's symptoms are very real. And so there was a group of GI people who got together, and they're called the Rome Foundation, like Rome, like the city in Italy.
I love it. I'm Italian, so that's
Yeah,
totally up
yeah.
my alley.
Yeah, I know. But you know what? They've never invited me to come to the meeting. I'm kind of bummed.
I would
But
too. I want to go too. We can go together.
yeah, but anyway, they meet like every 6 to 10 years, and they get together and talk about um, they've really been instrumental in classifying these disorders and telling us how we can treat them. So they're about right now we're on Rome 4 criteria, but I think they're meeting very soon. And I want people to understand that these DGBIs are multifactorial and there isn't just one cure for them, and there are multiple disorders that fall under the umbrella of DGBIs, which you mentioned. Like everybody knows about IBS, but there's functional dyspepsia, there's functional constipation, and currently there's 33, I think, adult DGBIs and 20 pediatric. So
Oh wow, I didn't realize there was that many.
yeah. So it's really very prevalent, and it's so important to have people like you who are advocating for patients because there used to be a lot of kind of I don't know, it was almost like shame associated with this because people would be like, "Am I crazy?" I can't tell you how many times a patient came to me and it was like, "Am I crazy because my primary care doctor told me, all my tests are normal, but I still have all these symptoms." And no, they aren't crazy because the gut and brain are talking to each other, and there are all these disorders associated with gut and brain miscommunication. And I think that's the important thing to realize that even though there are no definitive biomarkers or structural abnormalities, the one thing that all DGBIs share is that there's miscommunication between the gut and brain. And when the conversation between the gut and brain gets disrupted, there's changes in how we feel and how information from the digestive tract is perceived and interpreted by the brain. So, yeah. Does that answer the question kind of? It's yeah. Yeah.
Oh, yes, of course. No, that was great. That was a wonderful explanation. Um, so why would you say is stress such a big trigger? Stress causes so many terrible things in our body. And how do you explain that yoga to be beneficial for that?
Yeah, that's a great question because we know, like you said, that stress is a contributing factor to so many, not just GI disorders, but hypertension, type 2 diabetes, all these things are affected by stress. And because the gut and brain communicate, stress and anxiety can really intensify symptoms in the GI tract. And I think it's really important to have a more holistic view of medicine and realize that we can't just treat the symptoms of the gut if the gut and brain are connected. We need to treat both the gut and the brain through mind body interventions like yoga, cognitive behavioral therapy, and gut directed hypnotherapy. But in order to understand how stress affects the gut, you kind of have to understand a little bit about your autonomic nervous system. And if you remember, like from high school biology, your autonomic nervous system is the part of your nervous system that you don't have to think about. It's working all the time. We breathe without thinking about it. Our heart fortunately beats without thinking about it.
Yes, thank goodness for that.
Exactly. But there are different branches of the autonomic nervous system. And when you look at it through an evolutionary lens, you can see that this autonomic nervous system really evolved to keep us primarily, first of all, safe from threats in the environment. So if a tiger was chasing you, you better be able to run. And so the sympathetic branch of the autonomic nervous system is called our fight or flight mode. And we probably all heard of that. And really, your body reacts to a stressor without you even thinking about it. You've probably noticed your heart rate goes up, you start breathing rapidly and shallowly, and it changes how your GI tract works because guess what? Your GI tract is mainly associated with the parasympathetic or rest and digest mode. And so when your sympathetic nervous system gets turned on, your rest and digest mode slows down. You don't produce as much saliva, your stomach emptying slows, you have changes in motility in your GI tract. So all these things happen without you thinking about it, but it turns out that there are ways to balance the nervous system, one of them being through yoga and breathing techniques. And it's okay to be stressed as long as your body has time to recover. But in our fast paced world, the kids have to go here and you've got to work and you got to pick up your child at daycare, right?
Oh, yes.
We always feel like a
Of course.
tiger's chasing us all the time. So the gas pedal's always pressed all the way down, and there's no time for us to rest and to take care of ourselves. And when that happens, there are long term changes that occur. We produce all these stress hormones, and cortisol and pro inflammatory chemicals are released. So we have more likelihood of developing these chronic diseases. But in the gut, stress actually affects permeability, and that means how things come in and out of the gut, right? We want to keep bacteria in the colon. We don't want spaces in the walls of the gut so things leak out. And there's this term out there in the general population called leaky gut, and that's not really it's not really a real thing, but it's changes in permeability in the gut that happen when we're stressed. And it also causes changes in motility, and we all know that if you have a chronic GI disorder, like, it results in fear and anxiety. It affects how you live your life. You're afraid to go out and to dinner because you're afraid you're going to have diarrhea, and it increases your sensitivity to pain so that your brain actually starts interpreting signals differently. And so things that might not cause pain in somebody who doesn't have IBS, in somebody who has IBS, they have this what's called visceral hypersensitivity, which is really hard to treat. And this leads to catastrophization of their symptoms, because they're chronically worried. Yeah. So, but yoga really, oh my gosh, I could go on forever about yoga, how it helps, but it helps to bring the nervous system into a state of balance. There have been studies that show it increases heart rate variability, and that's like a sign of resilience in your body. Your body needs to be able to change heart rate, when you're stressed and when you're not. The breathing practices and postures help to tone and stimulate the vagus nerve, and the vagus nerve is really like a phone line between the gut and brain. And that's one of the reasons why diaphragmatic breathing is so effective, because that tones the vagus nerve that's associated with your rest and digest mode. And it's also thought to increase the good bacteria in the gut. People who exercise and do yoga have a better microbiome, a healthier microbiome. And the postures improve circulation to the digestive tract. They strengthen the muscles that support the abdominal organs. Some of the postures create movement or peristalsis in the colon, and others help to kind of slow down peristalsis. So it's amazing the effects that yoga can have. And there was actually one of the reasons I started uh, doing yoga for gut health was my patients would come to my classes and notice they felt better. And then I saw a study, I think it was in 2018, of 12 weeks of hatha yoga versus 12 weeks of a low FODMAP diet, which that's a diet that's used in IBS. And yoga was as effective basically as right? Yeah.
Oh, that's amazing. Yeah, because I know a lot of patients, they get confused with the FODMAP diet. They can't follow it. It's little bit, they're not, it's not as easy to follow or understand for many patients.
Yeah,
So
I'm glad you
that's
brought that up
interesting.
actually, because it's really important for listeners to realize that the FODMAP diet is not ever meant to be done long term. It's a three-phase diet where you remove possible triggers, then you add them in, then you really should work with a nutritionist to find a varied diet that's it's good. And though it is effective, it's never meant to be done long term. It's really to help you find your triggers and then develop a diet that is healthy and varied. So,
Sure. It's like a kind of a temporary transitional diet,
Yeah,
you would say. Yeah,
exactly. Yeah.
that's perfect. So tell us a little bit more, and you did touch on this a bit, about how you use yoga therapeutically for these patients. Is this something that every patient kind of starts with the same thing, or does it vary based on their symptoms? Or, tell us a little bit about the process of starting yoga for these patients.
Sure. So I think anytime you begin to connect breath and movement, you're going to tap into the parasympathetic nervous system and feel better physically, emotionally, and even,
Agree.
spiritually, right?
Yes,
And
definitely.
yeah, and I think now too that we've come to look at these DGBIs through the lens of the biopsychosocial model, that we realize that it's not one thing, it's genetics, it's relationships, it's social support, it's, people who have go out on vacation and get some kind of bacterial infection like Campylobacter have they have a fourfold increase in IBS the 12 months after GI infection. So, and even early adverse life events. So, it's not really hard to diagnose DGBIs. You don't need necessarily all kinds of tests, but you need a really good history. People who are exposed to early adverse life events, and that doesn't just mean like physical abuse, it can be trauma that's psychological, they're like at an increased risk twofold for developing these DGBIs. So we need good histories. And like your program has mentioned, it's really hard to have time as a practitioner to spend the time to get to know the patient in one office visit, right? And that's why,
No, it's so true. I mean, the system is unfortunately not set up
yeah.
to allow for that.
Yeah. So what you're doing is so important. And yes, as a, nurse practitioner, I like to think that I definitely was an advocate for my patients, but yeah, it's really important to see your patients back and to develop a relationship with them so that they're part of the healing process. And so for yoga, yeah, I mean, people might the thing I hear the most that really bothers me is people say, "I can't do yoga because I'm not flexible." Well, that's totally not true. Yoga can be adapted to almost any body type or regardless of what's going on. Maybe you don't need a vigorous practice. Maybe you need chair yoga. Maybe you need to just learn some breathing techniques and very gentle movement. So I've developed this series that I teach at Reston Community Center in Northern Virginia that I offer as an 8-week series. And we spend about 15 minutes talking about different GI disorders. And then we do like an hour or 45-minute class. And then I also teach at Beloved Yoga and I offer workshops called Gut in Mind, I think I call it, that uses yoga postures, breathing techniques, meditation, and relaxation to tap into the rest and digest mode and teach patients to become more aware of the gut brain microbiome connection. And a lot of it, like you said at the beginning, is about awareness. People don't understand this connection. And when they do, they're like, oh, no wonder I feel like
Yeah,
this, right?
no, 100%. So you have some great programs. Are all these programs in person? Do you offer any virtual programs at this time?
Yeah, so I have only been doing them in person. I did do one virtual program one time, and that's a really important point because how do we reach people? And I would like to just say that there's a group of gastroenterologists that I worked with, and they now have a website called pandorahealth.com, and there are free yoga videos that
Nice.
I gave them. They're not real professional videos, but they're yoga videos. And also there's a video on diaphragmatic breathing. And I think I have a relaxation video on there and it's free. Pandorahealth.com is free. And these are all, like you said, the office visits are so quick, we need a forum where patients can go in between time to get good information. And this, it's a fairly new website, but the content is being monitored by the GI people, and they're trying to keep it very real, and there's lots of conversations. So I think it's going to be, I'm excited about that, and I hope it turns into something bigger for people, because people do need a source. There's so much stuff out there that's not good information, not evidence-based. So we need like a source that people can go to and feel good about in between doctor's office visits.
That's so amazing. I love that as a resource. That sounds amazing. So my next question is, can you explain what is exactly gut-directed hypnotherapy? And this is something that I'm not actually that informed on, so I'm interested too.
Yeah, it's so people have all kinds of crazy ideas about hypnotherapy, but gut-directed hypnotherapy is actually an evidence-based mind-body intervention that's recognized by the American College of Gastroenterology as a therapy for certain disorders of gut-brain uh, disorders of gut-brain interaction, and it targets the communication between the gut and the brain. And it should be performed by a trained clinical provider. So you don't want to just go to any person for this.
Not like your
And
friend or someone to do it.
right,
Got
right,
it.
right, right. So, but it uses communication skills, and it involves first narrowing the focus of attention by having a person like focus on a point and really have them put all their attention there. And while they're doing that, you take them into a very deep physical relaxation. As a matter of fact, that's the biggest part of the hour is taking people into this relaxed state. And not everyone does this, but I do diaphragmatic breathing before the start of the session to kind of give us a leg up. And then once they're in this relaxed physical state, you add imagery. And I use a protocol developed by Dr. Paulson at UNC. And each time it's a different imagery. It might be going to the beach, it's a log cabin, it's a garden. And then you let them use their imagination. It's really the person who's accessing the subconscious mind. And the subconscious mind is not like your conscious mind. A, it's more linked to emotion. It doesn't have the same sense of time, and then the final piece is to add positive suggestions to facilitate improvements in the functioning of the digestive tract. And I'll be honest, I was even skeptical at first, when I learned it, but I've been doing it now for 2 years, and I've seen amazing results in patients. It's really kind of exciting. And I think it's like the perfect thing, complement to yoga. And there's been multiple studies now by Dr. Paulson that show improvement in those really hard to treat symptoms like visceral hypersensitivity, bloating, pain, your bowel patterns. So, yeah, it's really exciting. There's even apps now that you can get for gut directed hypnotherapy. And there was a study in the American College of Gastroenterology Red Journal showing that they have benefit too. I think part of my success is that not only do I have a GI background, but I have the yoga background, and it's really, you form a relationship with the patient. It's 7 sessions done 2 weeks apart, and then you give them a recording to listen to after the second session, where they're supposed to listen to that every day to help them to learn to, almost like self hypnotize, because really all hypnosis is really self hypnosis. It's just I'm kind of their guide. But yeah, it's really fascinating. And there's a lot of research looking at why it works. And yeah, it's pretty cool.
That is really interesting. That sounds great. So, for someone listening who's newly diagnosed with DGBI, where should they start?
Well, I think most importantly is make sure you have a provider, who listens to you and realized that these are real disorders that can be diagnosed. So get a diagnosis. Don't go to somebody who says, "Yeah, I did all these tests and I don't know it's all in your head."
Isn't that amazing how often that happens? It's sad actually, but it's a lot of
It's
times.
sad that it still happens,
Agreed.
yeah, because I've been doing this a long time and it's evolving, but we're not there yet. But I think in the GI world, hopefully, if you go to a gastroenterologist, they should be very aware of these disorders of gut-brain interaction. And for people who are new to this, you might want to check out, I told you the Rome Foundation are these people who get together and decide on the diagnosis criteria. They have a website and you can go on there. There's a lot of good information on the Rome Foundation website to help people understand these disorders of gut brain interaction
Sure.
and realize that you need a village for DGBIs. And I realize not everybody has access to that, but it's great if you have somebody who can be your advocate, and also, not just a gastroenterologist, but maybe a GI psychologist, which is a growing field, or a GI dietitian, as well as a yoga teacher or a clinical hypnotherapist. I mean, I think because these are multidimensional, multifactorial disorders, we can't expect medicine to be the only answer. And I will say that, yes, of course, as a nurse practitioner, I've used many medications, and we have a lot of new good medications for things like IBS, but it's not the whole answer. We have to treat the whole person, the gut, the brain, and even, the spiritual part of people. We have to look at the whole person.
Sure. No, I think that's super important. I think that is a great summary of how to kind of start and proceed with this.
Oh, and one more thing, I would just say look at diet, because in GI, this is a huge area of research. Both we didn't talk about the microbiome, but it's so important. And the best way to change your microbiome is through your diet. Hippocrates, who was a Greek philosopher and the father of Western medicine, said it, over 2,000 years ago, let food be thy medicine and medicine be thy food. And he believed that all disease begins in the gut. And we're learning that a lot of diseases do begin in the gut. Look at Parkinson's. They think, it used to be, oh, this is a brain disease, but now we're thinking it really begins with the microbiome in the gut.
Yeah, that's so interesting to me. It really is.
Yeah.
Well, Christina, you've given our listeners so much to think about and, more importantly, hope. Disorders of gut brain interactions, or DGBIs, may not be visible, but they're, fortunately, they are treatable.
Yes.
And I thank you so much for your incredible work that you've done in this space and that you're doing. Um, I've learned a lot, and I know our listeners will learn a lot as well.
Well, thank you so much for having me. Sometimes I get very, you know, energetic about it because I'm very
I love
passionate
it.
about it, and there's so much to tell people. But I think what you're doing is great too. So keep doing what you're doing. All right.
Thank you. Thank you. Well, I'm sure our listeners would love to know more about sunshine yoga and digestive health, and are curious how they can connect with you. Where can people find more information about you and the work that you're doing?
Yeah, I mean, you can always contact me through my email. It's yoga Christina23 at gmail.com. And there's more about on the beloved yoga website in Reston, Virginia, on hypnotherapy, because that's actually where I rent a room and do that in that space. And yeah, check out pandorahealth.com and try some yoga for constipation or diarrhea, or learn diaphragmatic breathing. That, the more I can get it out there to people, the more excited I am about it.
Well, that's amazing. Thank you again. And I hope this conversation helps our listeners feel more confident as they navigate their healthcare journeys. Have a great day. Thank you so much. If you have a question for Ask the Patient Advocate, email advocate@pathwaypa.com. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together.